My name's Oliver Kays. I'm a consultant urologist and I work in Leeds teaching hospitals here in England. Men suffering from erectile problems varies due to their age. So we wouldn't expect that many percentage-wise of men in their 20s and 30s to be suffering from soft erections or difficulties achieving an erection, but that steadily increases in incidence as you go through your 50s and 60s. So by the time you're in your sort of older age, we'd expect as much as 50% of men to suffer some degree of erectile problem. So I think this is a really interesting aspect of understanding why men have erectile problems. On the one hand, psychological problems can precede any erectile problem, but once you develop an erection issue, be it not being able to achieve or sustain an erection adequate for intercourse with your partner, you soon develop a stress anxiety problem, and therefore there's a massive overlap between the psychogenic and organic symptoms that men come and present with. So in the UK, one of the highest rates of referrals are around this condition. So we have to be very much pinpointing those men coming to the right experts here in urology so that we can understand holistically their general men's health issues as well as the specific sexual dysfunction they are suffering from. So usually most of these men will come via their GPs, their general practitioners, who will evaluate them and give them some first line assessment and treatment in the first instance. And it's really important that men engage with the community doctors in that sense. Thereafter, if treatments are failing or there's a more complex problem, then often they'll be referred into either myself as a consultant urologist, one of the team, or even one of our nurse specialists. With any therapy that we suggest, the first thing that has to happen is the patients have to engage. There's very little response if patients take medicines ad hoc or don't adhere to some of the lifestyle advice that we give them to try and improve their general health, which will then impart a huge benefit on their sexual function. By the time we've reached that stage of a consultation, sometimes it's because men have been through years of therapies, both successfully and unsuccessfully. When treatments start to fail, obviously they're looking for improvements and looking to escalate the care that they're receiving. And often we'll do that either in my clinic or through one of the nurse-led clinics where they'll get appropriate counselling about what a penile implant would mean to them. Reliability and durability of the devices is important, but it's only one factor of the issues that we go into discuss with them, because this will be a life-changing decision for them. And often, once counselled appropriately and mentally in the correct place for surgery, the outcomes are excellent. So every implant we put into a patient, there is a natural longevity. And one of the things that will impact on that is how often it's used. So younger men who are more sexually active may find that their implants fail or become less usable in a shorter space of time. And we have to remember that these are mechanical hydraulic devices. And so anything from a small fracture in the tubing causing a leakage to another part of the device not working will cause the implant to fail in some degree. I tend to say that patients will often need to come back for revision surgeries around the 5-year mark. It may be sooner if there's a problem, such as an infection. But implants on their own, used sensibly, can easily last 15 years. I think this takes us back to the question around counselling. Men really need to be well informed about what it's like to live with a penile implant. The satisfaction rates are so high because the devices are so good, and the reliability that you're going to get an erection good enough for intercourse almost immediately. The delay from surgery to re-engaging in sexual relationships is as little as 6 weeks, whereas other treatments can be hit and miss. You know that this is going to work every time for you. So discussing some of the negatives with the patients up front, we would certainly highlight that the device feels like it's artificial, the erection is hydraulic and therefore not a physiological normal erection. There can be a feeling of discomfort sometimes, or a feeling that the implant is in place. But all of these will soften with time as people become more used to having the implant in place and using it as part of their sex life. The spectrum of treatment, though, is very wide, and we really do preserve surgical penile prosthetic insertion for those with end-stage erection failure, because you're moving the man to a completely new domain regarding his sex life. But if you consider upfront costs, the number of years these men will be on medications and moving through different therapies, the number of consultations they'll have with their primary doctors and also back at the hospital, all of that is quite a cost burden, particularly within the NHS here in the UK. Therefore, once men decide to go towards a surgical answer, and this is the same for a number of other conditions away from erectile dysfunction, you know that with good reliability, good devices, good success rates and outcomes, and patient-directed goals, these patients are going to be satisfied and attend less to the hospital in the future. So any man who reaches that stage of their journey should be entitled to treatment on the NHS. Obviously, access to care is variable around the UK. And my advice to anybody going forward would make sure they seek out an expert surgeon in a centre that does a large volume of these types of surgeries. And I'm sure they'll be able to be helped by a consultation and treatment. When I see patients privately, the care is exactly the same from my perspective. So I will still counsel them about the relative variety of treatments, including penile implants if it's appropriate. And then I would encourage them to discuss that with their insurers directly so they can get an exact answer about that slightly tricky financial discussion. Due to the pressures on the NHS, this type of surgery can wait an awful long time, and I'm always impressed by the length of time men will wait and be very patient until it's their turn for surgery. So actually very few people decide not to go ahead. And I think that's also a testament to the way that we counsel the patients, so they fully understand the implication of what the problem is, why we've had to resort to something like a penile implant, and for them to fully understand what that means for them for the rest of their life. So waiting on the waiting list is actually time to reflect, contemplate, and decide if it's a positive or negative thing for them, discuss that with their partners, and nearly always they'll proceed directly to surgery as planned. So the malleable implant is a semi-rigid device, and it's really the simplest form of an implant that we would put into a patient. And it's been around for quite a long time now, so we know they're very robust, very easy to use, very simple to put in surgically. Typically under an hour, this could be placed in the penis, 2 cylinders in the shaft of the penis. When you want the penis to be semi-flaccid, you point the penis away. When you want it erect, you simply point it in a straight position, and then it's rigid enough with the 2 cylinders in place to achieve penetrative intercourse. We really like to use these in a number of specific circumstances. One would be the patients who are probably not fit enough surgically to undergo a more major operation, or have had lots of previous abdominal or penile surgeries in the past, so scarring would be a concern. If their hand dexterity is a little difficult, so they will find it hard to manipulate a pump, then these are very simple to use. Either on their own or their partners can simply, as part of foreplay, straighten the penis out. Sometimes we use them in the revision surgeries, and therefore they're an important component of how serious implanters around the world will maintain their practice and ensure that the best outcomes are achievable in every case. So the implants are measured and positioned into the penis, so they're an exact fit. You will see no component on the outside of the body at all, and the idea is that through a very small incision we can place these implants that will heal very quickly. So externally these wounds will heal within 2 weeks, internally a little longer, so we always recommend 6 to 8 weeks until resuming some form of penetrative intercourse. If you do ever see any part of the device, then we call that erosion, and that's a medical emergency, and we'd advise you to come and consult with us immediately you see any problem like that. Nowadays, the standard of treatment really is the 3-piece inflatable penile implant, and that consists of a reservoir, a pump, and 2 cylinders that sit in the penis. The benefits of an inflatable device are about the natural feel of it. So cosmetically, in the flaccid state, the penis resembles a normal flaccid penis, and it wouldn't be entirely observable to anybody who saw the patient naked that they actually had a penile implant in place. Likewise, the reservoir is positioned behind the pubic bone. So again, through small incisions, this can be discreetly positioned away from the main area, and it holds the water that's important to pump through the system to cause the erection. That's achieved using the pump device. And this is some very clever technology because it has a pumping system here, which you squeeze, and that will push the fluid down into the cylinders. And only after a few simple pumps, that will achieve enough rigidity for intercourse. And compared to previous treatments a patient may have tried, which may have been hit and miss and may have taken some time to be effective, we know with penile implants that you can achieve an erection within 15 to 30 seconds. You can then have sex because there's no risk of losing your erection. And when you're finished, the deflate valve, and this device is actually positioned in the two side positions. You squeeze it, and then gently squeezing the penis will push the fluid back to the reservoir, and the penis will go back to a flaccid position again. Sure, I'll take you through every component so that you understand exactly what the materials are and what we use as part of the inflation device. So the white coating that you can probably see on the film, this is silicone based, and underneath that is a much more durable material. That means that the implant has durability over a lifetime. So this is a three-piece inflatable implant. It's called a Coloplast Titan Touch, and all the implants have a standard makeup, which is they have a reservoir, a pump system, and the cylinders that sit in the shaft. They are covered in a tough material, which is durable and unlikely to have a problem over its lifetime, so that it can be repeatedly inflated and deflated easily. And that process starts with the fluid that's kept in the reservoir, and we use a simple saline solution which is physiologically the same as would be in the body, so there's no risk of harm to the patient at all if that leaked out of the reservoir. That fluid then passes down the tubing to the pump, which then pumps the fluid into these cylinders. And the whole material that encases this device is cleverly coated with a substance which allows antibiotics to be impregnated onto the device, so that the risk of infection, which is a major problem if it occurs in patients, but is happening far more frequently with this type of surgery now due to the developments in the surgical technology. So there's a number of precautions we have to take when we're putting in a surgical implant. Most of those are around surgical technique and infection risks and ensuring a good quality outcome for the patient. One of the most important factors around that is making sure the implant fits appropriately to the penis, and that all components are inserted inside the body and are, to the best of our ability, discreetly placed so that they don't cause any discomfort for the patient, and are not obvious if somebody was to observe the patient externally. And that's also important in patients who have looser skin, so that they can easily manipulate their fingers all the way around the bulb of the pump and access the valve mechanism, which they can touch and allow the fluid to move around the system easily. Regarding the length of the implants that we can put in, these come in various sizes, and we can increase or decrease the length of the device to bespokely measure for that particular individual exactly how long that device has to be. And internally, as part of the operation, we do that with a measuring ruler, which is specially designed to accurately measure the whole length of the penis, both the penis that's observable on the outside of the body, but quite a lot of the penis that's inside the body. And so we get a very snug, nice fit to the implant, which prevents future problems where the implant may move, be too short or too long. There are a number of known conditions where end-stage erectile failure is going to be more common, more frequent, and occur more quickly to patients. And particularly I'm thinking about those sort of patients who have undergone pelvic surgery or pelvic trauma, where the loss of erection can be very sudden. Likewise, patients who have been involved in significant road traffic accidents and suffered a spinal injury due to some fall or other injury. And for these patients, life can change very quickly. And for them, I feel it's very important to set a realistic goal that no matter how treatments may go in the immediate phase, there's always an option with a penile implant that will give them a reliable return to active sex life. The other patients, it can be a more gradual process. So diabetics, for instance, they will invariably lose their erectile function earlier than a man aged the same but without the condition. So it's worth raising with them as part of their diabetic management at what point they may start suffering from these problems, and again highlighting to them somewhere in the distance on the horizon that actually if all medical treatments fail, there is a surgical option. And whilst it's a radical change of treatment, it's a really fantastic opportunity to restore sex lives, restore relationships, and patients are over the moon when things go well and they can return back to their loved ones in a sexual and positive fashion.